Hello, everyone, and welcome to the first Simon Says Expert series of 2024. I'm Debi Buckles. I'm the Tobacco Control Branch Leader with the Office of Community Outreach and Engagement here at the IU Simon Comprehensive Cancer Center. So we're going to start off today. Let me start by sharing my screen here. You can... There we go. So, as I said, I'm Debi Buckles. I'm joined today by Natalie Rivich of the Indiana Department of Health. She's the Director of Health Systems Change and Cessation Services. And so, since it's a new year, what better time to improve your health than by quitting tobacco? So, both Natalie and I know that's easier said than done. So, today we'll be discussing some immediate and long-term benefits of quitting, as well as, hang on one second. Sorry. So we're going to be discussing some immediate and long-term benefits of quitting smoking, as well as other tobacco products, not just cigarettes, such as vaping, tobacco pouches, and smokeless tobacco, cigars, and pipe. And then we're also going to talk about treatment options and how to stay tobacco-free. So before we begin, I'd like to tell you just a little bit more about myself. I'm a certified tobacco treatment specialist and trainer and serve on the Council for Tobacco Treatment Training Programs, as well as the Association for the Tobacco Treatment and Use and Dependence. And during my 27-year career in the tobacco treatment field, I've helped hundreds of people quit using tobacco products, coordinated and developed tobacco training programs and treatment programs for healthcare professionals and laypersons across the state. And I've worked on multiple research projects and provided technical assistance to quite a few healthcare organizations across the state as well. So today I'm going to focus on the benefits of quitting tobacco products, as well as the tobacco treatment options. So let's get started. So I don't really like to spend a lot of time or talk about a lot about what I call the ain't it awfuls. But here it is. It is important to know that tobacco has been firmly linked to at least 12 different kinds of cancer, which you see here on your screen. People often associate smoking and lung cancer, but oftentimes don't think about other cancers being related to tobacco use. And so according to the Centers for Disease Control and the U.S. Surgeon General, 1/3 of all cancer deaths are caused by smoking, and 40% of all cancers diagnosed in the U.S. are related to smoking and tobacco. And it's not just cancer we need to be concerned about, but there's lots of different other health issues too, including and certainly not limited to heart disease and lung disease. So I want to point out that when we talk about tobacco today, we are talking about all commercial tobacco products, including vaping, smokeless tobacco, the tobacco pouches included, and pipes and cigars and things like that. All of them are harmful. And so quitting all tobacco products is the best way to improve overall health. And so one of the things we like to say is quit, don't switch. So, all right. So this is a slide showing you a little bit about what is in tobacco smoke, specifically cigarette smoke. Tobacco use is related to cancers, all types of cancers throughout the body, because when somebody is inhaling cigarette smoke, that smoke is inhaled into the lungs and then absorbed through the lungs into the bloodstream and pumped throughout the entire body. And as you see here, there's an estimated 7,000 toxins in tobacco smoke. At least 69 of those are known or suspected to cause cancer. And so nicotine is one of those compounds, right? Nicotine, though, does not cause the ill health effects. It does not cause heart disease, lung disease, or cancer. It's the other 6,999 other components or toxins in the smoke. Nicotine is what's addictive and keeps the person coming back to using those tobacco products. So I want you to keep that in mind as we talk later about some of the medications, okay? All right. The good news, this is what I like to focus on, is the good news is that when someone quits smoking or using tobacco, and specifically this chart is looking at quitting smoking, okay? We're not really sure about the immediate benefits of other commercial tobacco products, but specifically the recovery benefits are listed here. And there are immediate benefits in as little as 20 minutes, as you see here, with positive changes to heart rate and blood pressure and all the way up to 15 years. So this is something that's very important information to share with those of you that know those of you that know people that smoke. So we want them to know the positives. The benefits occur very, very quickly. Also, if you or someone you know is currently using tobacco or has in the past, it's even more important to get your cancer screenings. So detecting cancer at early stages, often before any symptoms appear, is the key. This is especially true for lung cancer, which often people aren't diagnosed with lung cancer until very late stages. But early stage diagnosis allows for much more treatment options and up to a 90% cure. So screening works because it finds lung cancer at a much earlier, treatable, and curable stage, even before symptoms. So talk to your doctor about what screenings you're eligible for. We want you to know that anyone with lungs can get lung cancer. We want to reduce that stigma around lung cancer, although cigarette smoking is the primary cause of lung cancer. We also want you to know that only 7% of eligible Hoosiers get screened for lung cancer. And that's in comparison to most of the other screenings, breast, colon, cervical cancer, prostate cancer. Those cancer screenings are typically in the 70 to 80% range of people getting screened. But lung cancer is very rare. Lung cancer screenings are not done as often here in Indiana. And with Indiana, we have very high smoking rates. So we really need to get our Hoosiers to get lung cancer screens. So talk to your doctors. In Indiana, because of the high smoking rate, lung cancer is the most common cause of cancer deaths for both males and females. And lung cancer leads to more deaths of women than cervical and ovarian cancers combined. And it kills twice as many women as breast cancer. So the good news here, though, is getting a lung cancer screening could save many lives. And so we need to get more Hoosiers screened for lung cancer. So who's eligible? Well, there are some eligibility criteria, so we want to make sure you know what those are. You must be between 50 and 80 years of age, either currently smoke or have quit within the last 15 years. And if you have to have a 20-pack year history to be eligible. So what does that mean, 20-pack year? How do you calculate that? That is the number of packs per day on average, multiplied by the number of years a person has smoked. So for instance, if somebody smoked 1 pack a day for 20 years, that's a 20-pack year history. Or another example, somebody smoked a half a pack a day for 40 years. That's also 20 years. And then of course, if somebody smoked 2 packs a day for 10 years, that is a 20-pack year history. So again, you have to meet these eligibility criteria. And I know one of the questions we had ahead of time was, is it important for somebody that's quit smoking? Should they still have a lung cancer screen? And the answer is absolutely yes, if they have quit in the last 15 years and had a 20-pack year history. Okay. So again, lung cancer screenings are very, very important, but a lot of people don't know what that entails. How difficult is that? What all is included in getting a lung cancer screen? I want you to know it's a really simple, easy thing to do. It's quick, painless, and easy. There's no needles, no dye, Most people can usually leave their clothes on, so you don't have to get into one of those hospital gowns. You don't have to stop eating or drinking prior to the test, and the scan only takes a few seconds. And if you want to go to this website, go2.org, they even show you a little schematic and tell you a lot more information about lung cancer screening. And at the YouTube link here, you can actually see a video of somebody having a lung cancer screen. So it's really very easy. We want to encourage people to get that done if they're eligible. And I also want to let people know it is never too late to quit smoking, even after a cancer diagnosis. Now, we know many people feel very stressed and overwhelmed with the recent cancer diagnosis and say, hey, I need my cigarettes right now because this is just too much. But we really need those patients to understand how important quitting or even cutting down can be to help their treatments be more effective. So when people quit smoking or quit using tobacco before starting treatment, that results in a 45% higher survival rate than those who continue to smoke. And quitting prior to treatment can improve the effectiveness of the cancer treatments. It also reduces treatment-related complications and side effects. And that's because of what the toxins in that tobacco smoke do to the person. And fewer complications means fewer treatment interruptions, which again comes back to the reason why treatment is much more effective if people are able to quit smoking before or early into their cancer treatments. So we want to encourage people to talk to someone about quitting or even cutting down before starting treatments. I think it's really, really important to know about who are those people you can talk to, who's going to be able to help you. And we're going to talk a little bit about that here in just a little bit too. All right, here's a little bit more about the impacts on cancer treatments. So one of the common cancer treatments is obviously surgery, and smoking or tobacco can result in quite a few complications from anesthesia, wound healing, as well as increased infection rates. And that's all due to those toxins, those 7,000 things we talked about earlier. And then during radiation, again, those toxins will reduce that effectiveness and impact how well that body handles those radiation treatments. And then, of course, chemotherapy, another common treatment. But tobacco use weakens the immune system, and so does chemotherapy. So, in addition, tobacco reduces blood flow by constricting blood vessels, which then reduces how well the chemo reaches the areas of the body where it's needed. So if the chemo is supposed to be, intravenous and it's going through the blood system, but your blood vessels are restricted, it can't get to those areas where it's most needed. So the bottom line for all of these treatments is that toxicity and infection can result in having to stop treatment temporarily or reduce the dosages of treatment, which can have an overall significant impact on the effectiveness of those treatments. Okay, so we talked a little bit about the benefits of quitting. Let's now move on to the treatment options. So one thing I want to say here is that no matter what tobacco product is being used, these treatments will be effective. So it doesn't matter if somebody's vaping, smoking cigarettes, cigars, pipes, or smokeless tobacco. These treatments will be effective, okay? So we want to make sure we made that known. What might be slightly different is the physical behaviors of the different tobacco products. So those that use oral tobacco products have that hand-to-mouth stuff, but it's a little different than smoking, okay? So we'll get into some behaviors here in a second too. The one consideration about the different tobacco products is that vapes and tobacco pouches have a different type of nicotine in them. It's called nicotine salts, which delivers a much higher nicotine concentration than some other commercial tobacco products like cigarettes, okay? So if you or someone you know, or you're working with somebody and helping them to quit using tobacco products, if they vape or use the tobacco pouches, they may need a little bit more of the medication that we're going to talk about shortly. And if you need some help with that, you are most welcome to reach out to me. I'll give my contact information here at the end. and I'd be happy to help you. Okay, so this slide is illustrating tobacco dependence as a two-part problem. So people cope with many different situations and emotions by smoking or using tobacco. So for people to be successful in quitting, we need to address all of these aspects of the addiction. The physical component is managed, not cured. Okay, I want to make that clear, just managed with medications. And these medications help to ease the physical withdrawal and cravings so that the individual can then focus on other aspects of the treatment. We want you to know that it has been well proven that the combination of medications plus counseling are far more effective than either one alone, as this chart here demonstrates. So I still hear all the time people say, oh no, cold turkey, that's the best way to do it. Evidence shows that is not true. Evidence has shown us the most effective way of quitting is combining medication and counseling. So how do medications help? What do they do? Well, many people think medications are a cure or a magic bullet or a crutch, but they are not. These medications only help ease the physical withdrawal symptoms, which then allow the focus to be on the behavior change and other coping mechanisms. So someone previously asked if medications help or do people just become addicted to them? And I will say that these medications are extremely helpful when they're used properly and the proper dose. And they were designed to not be addictive, but to provide just enough relief from the withdrawal to help people focus on other aspects and employ coping mechanisms. Now, what makes them different from cigarettes is cigarette smoke is inhaled. And when that cigarette smoke is inhaled, that's the fastest route of administration. So once you take a hit of that cigarette, nicotine hits the brain in 7 to 10 seconds, very quickly. Whereas with these medications we're going to talk about, that nicotine is not delivered to the brain until about 20 to 30 minutes later. And you don't get that high peak in the blood level of nicotine like you do with other forms of commercial tobacco products. So keep that in mind. So these products, even though sometimes people will use them for a prolonged period of time, I would much rather have somebody using these products that have just nicotine in them than having those other 6,999 other toxins in them. So again, this is a just nicotine and versus what the commercial tobacco products have. So again, I'd still rather have them use these tobacco products for a long period of time than going back to commercial tobacco. So currently there's 7 FDA approved medications. You can see them all here on the screen. Currently there are 5 types that do contain nicotine. So we call those nicotine replacement therapy products, or NRT. The 3 on the left-hand side of your screen are all available over the counter. So you can go to any pharmacy, any Walgreens, anything like that, CVS, and pick these up. Now, they are covered by insurance, though, with a prescription from a physician or an Indiana pharmacist that has been trained in a standing order is also able to provide these medications. So again, pharmacists in Indiana, if they have been trained in the standing order, can prescribe all 7 of these medications. But as I said, the 3 on the left-hand side, the gum, the lozenge, and the patch, all contain nicotine, and they're all available over the counter. Okay. Now, we do have 2 medications that do not contain nicotine, and you can see those on the bottom right side of your screen. And they have a red asterisk by them. That's bupropion and varenicline. So those are prescription only. They do not contain nicotine. Now, the nicotine nasal spray and the nicotine inhaler, nicotine is in the name, so they do contain nicotine, but they are prescription. Okay. So again, these can be obtained through a pharmacist or through your physician or prescriber. So a lot of times I get this question, what's the best medication? I want to use the best one. What's the best one? And that really depends on the person who's using the medication. It can depend on their lifestyle, their day-to-day schedule. It can depend on their health history, their experience in quitting. So, and then oftentimes people need more than one medication. We call that combination therapy, and I'll talk about that in just a second too. So, most people say that some of these products don't work. Not most people. I will say a number of people say, I've tried those medications and they don't work. What we have found is if people say that, it's typically because, number one, they haven't used the product correctly. So, for instance, the gum. It's not like regular chewing gum. You don't just chew it. You have to chew it until you start to taste the flavor, and then you park it. And you do this chew and park technique on and off for 30 minutes. Because when you park it, that's how you absorb the nicotine. And a lot of people just chew it because they don't know about this. Okay. The other common reason that these medications don't work is often because people don't get enough. They don't get a high enough dose of the nicotine for it to be effective. Okay. So this is why it's important to really work with somebody that knows what they're talking about. So again, I think it's important to get as much knowledge and information as you can about these medications. The additional benefit of using these products is that they are also associated with a reduction in weight gain after quitting smoking. Now, I'm not saying to use these medications to lose weight, because that's not at all what they're for, and that won't work. But these medications do help people who are quitting smoking to reduce the amount of weight gain. So these products, specifically the gum, lozenge, and inhaler, can be of assistance for those that have an oral fixation, for somebody using smokeless tobacco maybe, or for people that just feel like they have to have something to do with their hands and their mouth. I also want to make sure people know that these products are meant to be used in anticipation of cravings. So once you're already having a full-fledged craving, these medications take 20 to 30 minutes for the gum, lozenge, patch, and inhaler to work. So we really need to think about what are some common triggers or times or behaviors that people associate with smoking, and have them use these medications 20 to 30 minutes in advance of that. So for instance, a common example is people typically want to light up a cigarette after eating, or using some other tobacco product right after a meal. So what I typically suggest is people use one of these products just before they have their meal, or 10 minutes before they have their meal. That way that nicotine will be effective and on board at the appropriate time. I also want to mention something about the patch. The patch is something that takes 2 to 4 hours to be at a therapeutic level after you put it on. So some of these short-acting medications like the gum, the lozenge, the nasal spray, and the inhaler are really effective to use in that first couple of hours after putting the patch on, until that patch is up to speed where it needs to be helpful. Okay, now I told you we were going to talk about combination therapy, so we're going to move on to that next. So combination therapy means that you're combining two different medications. In the example here on the screen, we're combining the patch, which is the long-acting formulation. You put a patch on, you leave it on for 24 hours, take it off, put a new patch on. But it's good to supplement that with some short-acting gum, lozenge, inhaler, or nasal spray. And that's because you can fluctuate the dosage a little bit that way. And the clinical practice guidelines, which is our Bible, if you want to call it that, tells us that the use of combination therapy should be first line over using just one medication at a time. Okay, so that might be using a 21 milligram patch plus maybe the 2 milligram gum, or a lozenge, something like that. So we know this is much more effective in doing combination therapy, and so many more people can benefit from this. I want to make sure too, you know, that you can combine some of these short-acting medications, or even the patch, with something like bupropion, or otherwise known as Wellbutrin, or even varenicline, which is known as Chantix here. Okay. So we can even do those kinds of combinations too. All right, so now let's talk about the second part of the problem, the behavioral aspect of the addiction to tobacco. So this includes things like cognitive behavioral therapy, behavior modification, coping skills training, relapse prevention, and management are all ways to treat this behavioral aspect. So tobacco treatment specialists are highly trained in both medications and these cognitive behavioral approaches. And so while this may be a new profession to you, we are professionals that have been around for quite a while now, and we are specifically trained and possess the skills and knowledge to provide effective evidence-based interventions for tobacco dependence for all forms of tobacco and nicotine use. We understand the science behind tobacco addiction, and this is an addiction because nicotine is as addictive as cocaine and heroin. And so we also know about nicotine withdrawal symptoms and effective treatments. Unfortunately, we don't have a really good way to be able to find these professionals other than asking around. However, since we do train a lot of tobacco treatment specialists in Indiana, I do have a list of those that we have trained. And if somebody is looking for a tobacco treatment specialist, you're welcome to reach out to me and I will connect you with someone in your area. And in addition, in a moment, we're going to talk about another resource for this type of assistance, which is Quit Now Indiana. And Natalie's going to talk about that resource shortly. So people often use tobacco or smoke in many different situations. And these typically are referred to as triggers. So here are some of those on the screen. So these are things that things that they do or situations that they're in or feelings or emotions that will cause them to want a cigarette or to use tobacco. So most commonly, people smoke when they do things like drink coffee, drive the car, maybe they're on the phone, or like I said earlier, after meals, among others listed here. One way I want to describe this to you is that the average adult will take about 10 puffs per cigarette. And in Indiana, most people are smoking a pack a day, which is 20 cigarettes, or up to a pack and a half or more. So if we think about somebody that's smoking 20 cigarettes a day, taking 10 puffs on average per cigarette, that's 200 puffs per day. 200, up to 300. That's crazy, right? That's a lot. What other things do you do 200 times a day? Think about it. Maybe blink, breathe, and swallow, right? And those are things you do automatically without ever thinking about it. So that's the same for somebody that uses tobacco. It has become so automatic, they don't even think about it anymore. So we really have to help them change some of the routines and behaviors and think about smoking or think about using their tobacco products so that we can untangle those associations. And this is what makes it harder for people to quit, although quitting is possible. And that's why thinking about changing routines, avoiding certain situations, at least for a period of time, can really be helpful, as well as using some of those medications we just talked about. One thing too about the medications is they can help in some social situations when you're with other people that are using tobacco or other people that you associate with using tobacco. Okay. So cognitive behavioral counseling can help clients to really learn how to deal with these situations. And quitting does require people to not only change what they do, but how they think about things. So we call those cognitive strategies and behavioral strategies, which I'll give you some suggestions or examples in just a second. So again, this is why it's really important to talk with somebody that's trained in this field and knows how to help people with quitting and learning new coping strategies. But also, these individuals, tobacco treatment specialists, know how to help motivate people and how to help them reframe the way they think about smoking and tobacco. So a lot of times people just need to think about this in a more positive way. Think about what they're gaining, not just about what they're giving up. A lot of people, especially if they have cancer and they just think, I need this for my stress right now. Well, let's think about this in a different way. What could you be gaining from quitting at this time? As we talked about earlier, the treatment they're about to go through will be more effective and they'll have a reduction in some of those not so pleasant side effects from the treatment. All right, so here's a list of some suggestions or ideas for cognitive strategies. Remember, cognitive strategies are for fighting challenging thoughts. So it's a different way of thinking about things, whereas behavioral strategies are things they're going to do when they feel the need or want for their tobacco. So here's some suggestions for you if you are yourself trying to quit or you're trying to help somebody else quit. Here are some things and ideas and suggestions you could try. So I really like some of the cognitive strategies that really focus on I'm in control now and I choose freedom. Using tobacco is not an option. And things that are positive and reinforcing. I'll breathe easier and feel better if I don't do this. So great ideas here. The one on the behavioral strategies that I found a lot of patients like are the 5 Ds, which is to go through each of these 5 things: deep breathing, drink water, distract yourself, discuss with a friend, or do something else. Go through those 5 things whenever somebody has an urge or craving to use tobacco. A lot of times people like to brush their teeth because then their mouth feels and tastes good. I think one thing that you could do if you're a support person is if you know somebody's struggling, ask them to go for a walk, get outside, get some fresh air. And then one thing that can really help calm people is to light a candle and watch that flame. So, all right. So that's it for me today. I want to say thank you very much for your time, and I've added my contact information here in case you have any questions after today's event. And so now what I'm going to do is stop sharing and I will turn it over to Natalie. So thank you, everyone.
Thank you, Debbie. I appreciate that and the information you shared. Let me just do a brief introduction for myself. As Debbie said, I'm with the Indiana State Department of Health. I'm Natalie Rivich. I work for the Division of Tobacco Prevention and Cessation. Formerly, I used to work for Smoke Free Indiana, and I used to lead a grass-led coalition who worked on reducing smoking prevalence in Northwest Indiana. I'm going to go ahead and share my screen now and take you through some of the things that the Indiana State Department of Health offers to help people quit smoking. So, can you see my screen? Oh, yes, please. There we go. All right. So, Quit Now Indiana is the frontline tool for helping Hoosiers in nicotine dependence. The Quit Now Indiana interventions are evidence based with guidance from the Surgeon General's report, the U.S. Public Service Clinical Practice Guidelines, the North American Quitline Consortium, and the Association for the Treatment of Tobacco Use and Dependence. So you can see we have a lot of evidence around the services offered to help people in their tobacco dependence. And through our program, you can access live and digital coaching. You can select a quit date, manage your urges, and we also offer the FDA approved medications, some of which Debbie already discussed, social support, and creating a tobacco free environment. So if I want to just give you a highlight of the services offered through Quit Now Indiana, it has three components to it. So we have individualized coaching sessions that have highly trained individuals that specialize in helping people in their nicotine dependence. Members can chat with a coach one-on-one or over the phone or online. They can also text to get support and help design a personalized quit plan for them. We also have access to nicotine replacement therapy or NRT products such as patches, gum, or lozenge. We don't offer the other nicotine replacement or the other nicotine treatment medications that Debbie discussed. We just offer NRT, so patches, gum, and lozenge. Uh, and anyone who's eligible for those medications can get access to up to 4 weeks of medication for the adult program, up to 12 weeks of medication for our behavioral health program. And I'll talk a little bit more about that. The coaches will also help guide members in selecting the best NRT for them, and they'll also help talk to them about how to use the medications. As Debbie discussed, there is a, a little nuance to some of the medications, and we want to make sure that the members who are enrolling in Quit Now Indiana services are using the medications as intended. So they do spend some time talking about how to use the medications as well. We also have tech support or text to quit, which is a convenient and clinically proven successful tool for helping manage the quit process. The members get personalized text messages, on demand content, and they also stay connected to their coach through the text program as well. We also have an integrated digital support through our online dashboard, which allows members to create a personal quit journey with a clear step-to-step path to quit and to stay tobacco-free. Activities in that quit journey include there's steps to help support them, there's videos, there's quizzes, as well as a tracking device that gives them feedback to show them how they're progressing. The members also receive a free quit guide for them and then for other people in their family who can support their quit journey. And then the program is offered in a multitude of different languages. Now let's talk a little bit more about the coaching support. The Quit for Life online portal is hosted on the Rally Coach platform. That's what you'll see when you enter into the portal, with the technological capacity to offer members an interactive online journey experience. It's got a library of tailored content, and it also has an opportunity to schedule and participate in coach-led peer support sessions. They can interact with a coach via telephone, chat, or text. Members have access to unlimited inbound one-to-one coaching sessions, so you can call your coach 24/7. That's when they're available any day other than Thanksgiving and Christmas. So if you are having a moment where you need support and it's midnight, you can still call your coach and get support 24/7. Coaches are accredited by the Council of the Tobacco Treatment and Training um, uh, program. They are very highly trained coaches. Most of them are educated at the baccalaureate level. Many are trained in addictions counseling, and so they're very good, well trained, and able to support any member who's calling in for services. Members also have an option to schedule and participate in coach-led peer support sessions. Members are encouraged to take part in these group sessions. We know that people don't quit in isolation. They need support from others. So the group sessions have been newly added in the last year to offer that additional support. It's beneficial to be in a group environment because it helps normalize the experience. It helps members feel like they're part of a supportive community, and it allows members to share successes and learn from each other. So members also can swap group sessions for additional one-to-one sessions. So if you don't want to be in a group session, you can do a one-to-one coach session instead. So let me talk a little bit about the online dashboard. The online dashboard and the content is for self-paced exploration that members can access by their computer or their cell phone. The dashboard provides quick access to Quit Now Indiana services, resources, and tools, including profile and settings, managing NRT. It also has nudges and reminders to help connect the member to services. There's a library of lots of online tutorial information. It also has online scheduling tools, multimedia action card system, and calls to action. So it's really has this really nice online on-demand learning tracker to help support your quit attempt. So here's a closer look at the online dashboard content and the action cards. So members receive content cards that present the program content in small segments throughout the program. So you get a daily action card to check on your progress and look at how you're achieving your weekly goal. Members also receive a reminder card 24 hours prior to the start of their group or their one-to-one session. Members can clearly see their NRT dosing and their shipment status, and they also can get a bonus card occasionally related to their weekly goal. So to make it even more convenient, we do have a Rally Coach app that you can download and add for free. It's highly rated. It's available on both Apple and Android devices. So I would really recommend anyone who's enlisting in services download the app. It just makes it easy to access the services. This is just a snapshot of what the member experience is for our standard Quit for Life program. You can see here, the program is activated. But through the phone, text, or online referral, and you can also then enter into session 1, which is a one-to-one call with a coach. Session 2 is preferred to be a group session or a group video session. You can opt to do a one-to-one if you don't want to be in a group session, as I mentioned. Session 3 is scheduled to be a one-to-one session with your coach. Session 4 goes back to a one-to-one session with your coach, and then we go into another group session, and then we have a digital quit survey at the end of the program. So it's easy to enroll and to manage your service and preferences. There's 5 coach interactions, as I said, in total. 3 are planned one-to-one, 2 are group, and then this online dashboard will also walk you through those different milestones, as I talked about, that has interactive activities, videos, action steps, articles, helps you track your progress, all again to support you in your quit journey. The key is flexibility here. And so members can design their own personal quit journey that's right for them, and they can change things along the way. You're not locked into any set program. Again, it's flexibility. It's designed to meet your needs when you need them. And this helps you reduce those barriers. It helps you have a more successful quit attempt, and it helps you reach your goals. Here's just a snapshot of the different tailored programs that we have. You can see it outlines the different offerings in terms of number of sessions offered, the NRT that's available, and the amount of NRT that's available. So you can see we have tailored programs for pregnancy, persons who are pregnant, behavioral health, youth, and then the different programs based on their insurance, uninsured, Medicaid, Medicare, commercial, or military. There are 7 sessions for pregnancy, behavioral health, and youth. The traditional adult program is 5 sessions. NRT is available with every program other than the youth program because the NRT has not been tested and approved for youth use. But the pregnancy program, I just want to mention there that we have the pregnancy program that you can get NRT. We do need to make sure that your physician approves NRT for a person who is pregnant, and that you're working in conjunction with your physician in managing your quit attempt. Just because NRT is not right for everybody, we want to make sure that you're working with your physician if you're pregnant or if you have a high risk chronic disease, such as if you have a heart disease. You want to be sure that you're working with your physician on that use of nicotine replacement therapy. And we often get the question, how effective are our quit lines? Well, you can see here, if you look at the left side of the slide, if you quit cold turkey, only about 4 to 7% of persons who use tobacco are successful in a quit attempt and quitting tobacco use. But with the support of the quit line, which includes coaching and medication, you can see that 44% of persons who are using the Indiana Quit Now services were still quit after 7 months of tobacco use. And we asked about satisfaction. Did they have a good experience? 93% of persons who enrolled in Quit Now Indiana services have reported that they would recommend the program to friends. And so it's highly effective, and it's the best way for people to make a quit attempt. Now I want to pivot and I want to talk a little bit about prevention, because the best way to in your or not use tobacco is to never start. And so I just want to start by saying that most persons who start using tobacco use start before they're really legally able to use the product. And it's really because of industry targeting. And you can see here in this picture, this is what our youth see when they go into a convenience store or a gas station. They're just bombarded with tobacco products. So tobacco companies have been aggressively marketing their products to youth for all of their time. In history, and early use of cigarettes or other combustible tobacco products, including cigars or cigarillos or hookah, have led to nicotine addiction. And about half of the adults who are tobacco users report that they started before they were the age of 18. So we really want to make sure that we put the we highlight that the industry has been really aggressive at getting people to start using their products. And if we look at the current use of tobacco products among Hoosier youth, we just finished our Indiana Youth Tobacco Survey in September. And while cigarette use and e-cigarette use are down overall, we still have concerning trends with tobacco use. So over 1 in 10 high school students currently use tobacco. 1 in 30 middle school students currently use tobacco. So we still have a lot of work here to help our youth prevent using tobacco and quit using tobacco. And here are some of the resources that we have to help support prevention and cessation for our youth. So we have a three-prong approach, which is prevention, public education, and cessation. So public education is best done through mass media campaigns, and we do have some of those going on through. You can see here behind the haze is an internet-based campaign, and then Don't Puff This Stuff is a campaign through the Indiana High School Athletic Association. We also have prevention programs like Catch My Breath, Stanford Medicine Prevention Toolkit, and American Lung Association's in-depth program. And we work with schools and the school health liaisons to help promote those prevention programs. And then we have this third pillar of cessation. We have This Is Quitting, which is an Instagram-based text program, Ditch Vape, and Live Vape Free, which is another text-based program. And then Quit the Hit. We also have a program there. And I did also mention that we have a youth program for our Quit Now Indiana, but just we want to offer a multitude of ways for youth to quit tobacco use. And when I say tobacco use here, I'm really talking about vaping, since that's really what youth are doing. They're not really using combustible tobacco products as they are vaping. As I mentioned, the High School Athletic Association partnership. This is a social media campaign. We have venue promotions, radio promotions. A lot of times you'll see these promotions at basketball games and football games promoted at their venue. They're also via email and social media posts through the High School Athletic Association. So let me talk about youth cessation. These are the youth cessation programs that we promote. We have Quit Now Indiana, and you can enroll in Quit Now services just by texting READY to 34191. We also have Live Vape Free. Again, that's a completely text-based program, and they can text Indiana 873-373. With the Live Vape Free program, there's also an adult component, because we know how important adults can be in helping youth quit their tobacco use. We know the role of parents and leaders like coaches and school nurses, for example, can really help youth in their quit attempt. And so there is an online program for adults to help them learn how to start those difficult conversations with youth and help them quit. And then we have the This Is Quitting Ditch Vape. They can text that Ditch Vape to 88709, and parents can text QUIT to 847-278-9713. So let me talk a little bit more about the Live Vape Free program. This has online courses for youth. There also is a text-based action plan that's interactive texting. And then we have a coach support that they can access through chat and text. It's really a great program. They just text Indiana to 873-373. And as I mentioned, there's an adult component and a teen component. So adults can help their youth or youth in their life quit tobacco use by using the vape free. This is just a side-by-side comparison of the youth cessation services that we recommend. As you can see, the image sorts these programs by age, live support, phone counseling, text messaging, online tools, the price to help inform how do you promote these programs. So most are free, of course. We often get asked about what about youth who are under the age of 13? What do we do to help support them? Because we do know and hear from many of our community partners that youth under the age of 13 are starting to vape. We really don't have a program that's really specific for them. We would recommend that they reach out to their healthcare provider and work with your healthcare provider to help that teen or that youth quit their tobacco use. That wraps up my information about cessation and the Quit Now Indiana services offered the Indiana State Department of Health. This is my contact information. And I know we had a multitude of questions. So I'm going to stop sharing and we can open it up for some questions.
Yep, and I know I saw some in the chat, so let me pull those up. So Natalie, somebody asked, where'd it go? Hang on a second. So what is the rate of smoking in Indiana and where do we rank among other states? Would you like to answer that?
Sure, sure. Indiana is what is in a part, we call it the tobacco nation. We're one of the worst offenders in terms of tobacco prevalence. We're ranked fifth nationally in terms of tobacco use. So we have come a long way in terms of reducing tobacco use in Indiana, but we still have a long way to go.
Thank you, Natalie. Another one, what are you seeing in adults who grew up in households where both parents smoked? Is there screening available for us? So, Natalie, I know I see this a lot. I grew up in a household of both smokers, but I'm kind of the oddball. I obviously don't smoke, never did. I experimented and hated it. But we do see a lot of kids that grew up in households with tobacco use that they go on to use tobacco. What are your thoughts about that, Natalie?
Well, like you, Debbie, I grew up in a household of both my parents smoked, and unfortunately, I suffer from asthma as a result of it. So I do know firsthand the effects that you can have from growing up in a household with tobacco use. Interestingly enough, I think we often hear from persons that their parents smoked and then they picked up the habit as well, or not the habit, the addiction as well. So it's very common that even though you may have grown up in a household with tobacco use prevalence, it's oftentimes a key factor for why people pick up using tobacco. Did you want to talk about the screening?
Sure. Unfortunately, lung cancer screening isn't available for individuals that are exposed to secondhand smoke as of yet, although I know a number of us would really like to see that someday. So unfortunately, there really isn't any screening. But, make your voice heard, talk to your legislators. I would encourage you to do what you can to advocate for screening for those with secondhand smoke exposure, because we do know that is harmful and we do know that it has a lot of effects on people. So. Okay, so one of the other questions we had is what dangers are specific to pipe smoking for those in proximity to the smoker? And so, Natalie, are you okay if I address that? Would you like to? Okay.
Sure, go right ahead.
So like cigarettes, pipe smoking is not safe. There are secondhand effects. People near somebody that is smoking a pipe will inhale many of those harmful chemicals found in cigarettes, including nicotine and toxic chemicals, which are known to cause cancer, unfortunately. So the best thing is to avoid it. And we also want you to know that smoking a pipe is also addictive. There is nicotine in that, just like in cigars. And a lot of people think, oh, I don't inhale, so it's okay. Well, pipe smokers and cigar smokers still ingest that. They absorb it orally into their lungs. And then those, of course, nearby them also ingest all of those chemicals as well. And we do see more head, neck, liver, and lung cancers in pipe smokers as well as cigar smokers. And so it does jeopardize the health of those around you. So the best thing is to just do it outside, and especially staying away from pregnant women and children who are more vulnerable to it. So recent studies are discovering the harms of third hand smoke, which we didn't talk about much today, but that is a thing. And it is, that's like third hand smoke is when smoke settles, the constituents settle on clothing, fabric like curtains, walls, carpet, that kind of thing. And so children are much more susceptible to third hand smoke because of their smaller airways. So it's very, very dangerous, and we do want people to realize that. So best thing is to don't do it at all, or if people are going to do it outside or in a garage. Okay. All right. I know we're getting close to time, but maybe we could answer one more question. Looking through the chat here, see if there's anything else. I don't think I see any others there. Let me look at the questions we had ahead of time. Oh yeah, someone asked, how can I support a family member in quitting smoking? So first and foremost, I think the best thing you can do is to just have a conversation with them. Ask them, how can I be of help to you? Is it helpful if I provide you with some encouraging words? And if so, what kinds of things can I say that are encouraging to you? Do they need a reminder from time to time? And maybe provide them with a list of some of those cognitive behavioral strategies that we talked about earlier today, maybe asking them if they'd like to go for a walk when you know they're kind of struggling, or if this is a time that might be difficult for them. You could also ask them, if they have worked with somebody like the Quit Line or a tobacco treatment specialist, and if not, maybe you could help connect them to either of those. I think it's also important to remember for both the family member, as well as the person quitting, that quitting is a learning experience. And we know that on average, it takes 30 quit attempts for somebody to quit for good. On average, 30 attempts. So each one of those attempts is a learning experience. They learn something new, and they need to reframe the way they think about that quitting experience. It's not a failed attempt. It's a learning attempt, learning what is working and what isn't working for them. I will also tell you that I think it's good to just know that they have a person they can talk to, even though you may not always know the right answer or what to do. Just knowing that they have somebody there to support them. And if you let them know, hey, I'm here. I know this is going to take some time. This isn't going to be something you quit overnight, but I'm here to help you in any way I can. So, all right. I don't think I see any other questions. So with that, we will just wrap things up here. I want to thank everybody for joining us today. I really want to thank Natalie too for being here with us and helping us through this presentation today. Also want to thank everybody for behind the scenes here who helped us do this. Simon Says So, Jose, Betsy, Michael, and also, of course, Mika. Thank you all. Just so you all know too, you can find a recording of today's session and information about the other Simon Says sessions at cancer.iu.edu/Simon Says. So thanks everybody. I'm really thankful you all were here today. And again, thanks Natalie too. Take care, everybody.
Thanks, Debbie. Thank you, everyone.